Welcome back. I'd like to now introduce you to our next speaker, Michele Oldfield. Michele is a senior library technician with the Gold Coast Health Library Services. Initially, Michele's Queensland Health career of 27 years commenced with the then corporate office here in Brisbane. During this time, Michele has been a committee member with the library technician sections of ALIA, coordinator for the 1988 LT conference on the Gold Coast, plus in past years, she's been an active member of the state and national GuidesNet committees. Michele is going to present on COVID shutdown and starts and drives. Michele.
Thank you, Rowena. Just going to give you a little bit of a quick background on the library service here at Gold Coast. We've evolved over 33 years, we've figured out that's how old we are now. Our service is a large regional network hospital system now with 2 hospitals and numerous other facilities. The region spreads from Springleigh, south of Brisbane, down to the border and the mountain area. Our library service, again, as I said, it started in 1988 with a library assistant and a librarian. And we've evolved now to, over the years, from 2 people, sometimes up to 7, and we're currently 4 staff. Our service has evolved like online resources have. We've expanded as well. Online resources originally, of course, all in print, and now we have an online resource called CKN. And this concept is centralised to that print, moving from the print. And I do apologise, I'm just a little bit nervous. As well as our online presence evolving over the years, we've also evolved physically, and from 1 little hospital to 2 major hospitals. And with that development starting in 2002 with the acquisition of a second hospital at Robina, and then redevelopment of that hospital, a library presence there starting with a hot desk, and then moving to a full library in that facility with 24-hour swipe access and self-check machines. And then within a few years, we evolved to a larger facility where I sit today, which was a brand new facility right from scratch. And it sits next to Griffith University here at Gold Coast. And with this facility came that it was the opportunity to decommission an old hospital, which was very exciting at the time. And again, we got 24/7 access for our staff with swipes access to the library and self-check machines. So these things have played a big role in putting us in a better position today with what's happened recently. And during that time, people have moved from us locking the door at night time and asking them to leave nicely. And now we don't have to ask them to leave. We've actually set up things to make the library operational 24/7 when we're not here. If the self-check machine doesn't work, there's paperwork there for them to complete and leave for us to action in the morning. And the same with their swipe card, it's always that they have no problem getting in. They've got computer access, study areas, and it's all self-booking. The study area is self-booking, and then we even have designated computers with specialist statistics software that they can then also book a time to use. Again, it's all self-service, and this has evolved into making us very easily operational even now today. With the COVID hitting our shores, lots of preparation was being done, and when it happened, we had to shut both these libraries to hospital staff foot traffic. That was a big deal for us. And even at the time, there was a possibility of losing your job or even us being moved to another area of the hospital to assist with the contact tracing, which some of us even went and did some initial training, but that didn't eventuate. And we also went and worked from home, hospital laptops, which with library had a nice little supply for our training sessions that had been run in the library over the years. So that training, having that equipment really made it easiest for us to work from home. And even at the time, the hospital moved to using Microsoft Teams to communicate to us from face-to-face forums, which now our training has also evolved from that face-to-face in the library, us having to set up lots of equipment and lots of time, laptops in a classroom situation. Now we can Zoom into somebody sitting over in their office over in the hospital, or we can even accommodate 40 people in an EndNote session. And I believe Microsoft Teams can accommodate up to 250 people. That'll be a bit scary, having that many people at one time. But anyway, it's come about very useful having Microsoft Teams. Now, another first for our hospital, at the time when COVID did really hit it in early 2020, we had the first COVID patient in Australia, an international traveller. And then within a few months, we had the very famous pair who will remain nameless, Tom and Rita Hanks. Of course, social media took away the privacy, any privacy they had at the time. And we had the media camped outside the hospital with tents and all, waiting for every little bit of morsel of information. So it was quite exciting in the beginning, but not from a library point of view. We were very busy behind the scenes, and those first few weeks that things seemed to unravel, our clients went very quiet, and like us, they were trying to organise what they were going to do with their spare time. And all of a sudden we had this avalanche of work. Literature searches, document delivery didn't really slow down once that period sort of elapsed. But we created a task list for ourselves when we were considering what to do with closing the service or closing our facilities, but our service was maintained. But after a few weeks, we were able to, from working remotely, we were able to come back into the office. And I think the complaints at the time was internet access problems. One staff member experienced other family members working from home, the disruptions, like asking, where is the peanut paste? There was lots of different little discussions at the time. But during this period, we were developing our library policies for our book collection, and the library technicians drove this whole process in the book selection, ordering, receiving, and even right through to running a stock take. It was only a matter of time when we were asked to reopen the libraries, and we had to set them up in a mirror image. Initially only GCUH opened, and it was limited hours, but we created our unique signage and to ensure social distance. And we had to acquire PPE equipment, and we had to get clued up on it very quickly. And during that, once we reopened again after 6 weeks of lockdown, we opened the facility to 24/7 access, and then Robina also joined the 24/7 access again because it had been completely closed down to foot traffic. We then had to move everything virtual from face to face, and our orientations that normally were run with big groups each year was changed to virtual with myself being filmed. Our trade table at staff orientation ceased in 2020. That's run quite regularly by the library technicians, and we recommenced again in 2021. And our face-to-face training with the laptop setups moved to virtual. We also, during the lockdown, participated in the Creative Challenge at the hospital. And this is a couple of entries that were added or entered, and also that we also contributed to some singing events and found out how talented our staff were. during the whole process, I think we've found we're very resilient, and we've also found that our facilities helped us be resilient in the sense of we were also given very good local guidelines to work from with health and safety. We'd already met that with always having hand sanitizer in the library, but we added the extra with having to clean computers. We also, the ability to close the library easily for 24/7 access and then to limited hours was very beneficial, and the self-check gave us contactless, access for clients accessing books. Less handling. So there was a lot of things that we were challenged with, but we met the challenges and we still are. The workload's now gone back to sort of normal, and our foot traffic, we still are at half capacity, and we still, with our book returns, we did develop our own internal process for quarantining the books, and that still is happening because we still really are on alert here in Queensland. And we're just hoping that one day we will return to some normal. But it's been a challenge and an enjoyable one, but in one respect, and we're very fortunate that we've been able to keep working. And it's been very interesting today listening to all the other talks, and hopefully the rest of the day will be enjoyable for everybody.
Thank you for that, Michele. That was awesome. We're getting a few comments in the chat about thanking the health libraries for providing such assistance during the pandemic, because obviously you're doing a lot of the literature research behind all of the decision making that's going on there. Sorry, I'm sure it's a question.
That's actually one other thing I could say, Rowena, too. We found a lot of our searches that covered the area of reviewing their protocols. And so the doctors were taking the chance to improve their services and the way they deliver their services, and also I think they got a lot of benefit out of us moving to Teams and providing the training. It's saving them time. So there's a lot of benefits that come out of even just that small part of which we found very exciting.
Awesome. So thank you very much for that, Michele. We're going to take a quick break now, and we'll be back in a couple of minutes with another speaker. Thank you.